It's my privilege to introduce the Honorable Steve Leifman. Judge Leifman has been appointed as a special advisor on criminal justice and mental health to the Florida Supreme Court. He has recently been appointed as the chair of the South Florida Behavioral Health Network, overseeing a $72 million behavioral health budget. He is the co-chair of our Judges Leadership Initiative and has been since its inception. He has numerous awards and honors for his work in this area. He is wise, innovative, and passionate. He has been a colleague and mentor of mine for a number of years. He understands the issues as well as anyone in our country. And you may be asking at this portion in our agenda, why are we having a judge talk about maximizing health care resources? I trust that after he finishes talking, there will be an answer to that question, and you'll feel comfortable with him representing these issues. It's my honor and privilege to introduce to you the Honorable Stephen Leifman.
I particularly want to thank BJA and the Council of State Government for hosting such a phenomenal event. I think the only way that we're going to address these issues is by educating a whole lot of people that need to be educated, and this is a tremendous way to do that. I also want to thank all of you for being here today and for what you're doing. This clearly is an issue of epic proportion, and it's only going to be fixed one community at a time. And so I thank you and commend you for taking on this challenge. Now, if you had told me when I became a judge that one day I would be giving a major talk on maximizing healthcare resources and mental health financing strategies, I would have had a pretty good laugh. The last thing you want to see me near is numbers. I'm a little dyslexic. And I will tell you this is a topic that was never on my legal radar. But as they say, necessity, or in our case in Miami, desperation, is the mother of invention. Because I will tell you that when I became a judge, I had no idea that I was actually becoming the gatekeeper to the largest psychiatric facility in Florida, the Miami-Dade County Jail. Because the reality is that every single day, our courts, our jails, our law enforcement agencies are what I call a witness to a parade of misery by untreated mental illness. And clearly, and sadly, unfortunately, and inappropriately, you, me, we have become the lone responders for people with serious mental illnesses in this country. My journey into this field began one morning when I was getting ready to go onto the bench. I was approached by the Assistant State Attorney and the Assistant Public Defender, who asked me if I would speak to a couple whose son was in jail on a case I was about to hear. They were lovely people, very sophisticated, and horribly distraught. At the time, I was handling what's called a jail division for misdemeanor court, and those are people that are still in jail with pending misdemeanors. And for us, there's three kinds of people in that court. There are those with attached felonies who are not allowed out. There are those that are too poor to bond out. And then there are those with mental illnesses that don't know how to get out. So this couple came in, they were very shaken, they were crying, and they started to beg me to get their son help. They told me their son was a brilliant man. He had gone to Harvard, had a late onset of schizophrenia, and was now recycling through the criminal justice system in South Florida, and they just didn't know what to do. Being rather new and young at the time, I thought I had a lot more power and a lot more wisdom than I did. I made the mistake of promising them that I would get their son help. As I got up to go into the court, the mom stopped me and said, "There's one more thing I need to tell you about my son. He's brilliant, he can be very manipulative, and he understands the system better than just about anybody because, you see, he's the former head of psychiatry at Jackson Memorial Hospital, which is our largest public hospital in South Florida." So I went into the court and I called his case, and he stood. And if you didn't look at him, he sounded every bit the Harvard-educated doctor he was. And we started to have this amazing conversation. And I'm thinking to myself, my God, I wonder if there's something wrong with his parents. He is perfectly clear and alert, and except for looking a little disheveled and homeless, he's brilliant. And he was in on some serious crime. I think it was possession of a dairy cart. So if you come to Miami, be careful. And we started talking, and he seemed pretty good. He was like, Judge, I didn't do this, and if you want me to come back, I'll be happy to. I've already been in a couple weeks. This is ridiculous. And I said, well, just answer one question for me. He said, sure, Your Honor, anything. I said, I just don't understand because he kept insisting he didn't have a mental illness and he wasn't sick. I said to him, well, if you really aren't sick, I just don't understand why someone with a Harvard medical degree would be recycling through our criminal justice system. And apparently whatever I said triggered a crisis. And all of a sudden he got this horrible, horrible contorted look on his face, and he started violently shaking and pointing to the back of the courtroom. He said, Your Honor, before you go any further, you have to have that couple removed. You have to have that couple removed, pointing to his parents. I said, well, aren't those your parents? No. And he looked as if someone must look right before they're killed. He had such fear on his face. I said, he goes, Judge, my parents died in the Holocaust. They're here from the CIA, and they're going to kill me. So I immediately done which I had been taught to do, which was very little. If someone acted strange, order an evaluation. That's the extent of my training. So I ordered an evaluation. The first one came back. He was incompetent to stand trial. I needed 2 more for a stipulation. I ordered 2 more. He's now in 4 to 6 weeks on possession of a dairy cart. All 3 evaluations come back. He's incompetent to stand trial. I'm thrilled. I'm going to fulfill the promise I made to his parents. I begin to order him into involuntary hospitalization. I look down and I notice that the assistant public defender has a grin on her face. Now, I am a former assistant public defender. The grin is a really bad thing. And she then utters those words that the judges in the room can appreciate more than anything, or anybody. She says to me, Your Honor, in all due respect. Now, when lawyers say that to a judge, it has nothing to do with respect. And she tells me, basically, I have no legal jurisdiction to involuntarily hospitalize anybody. I took a break, I checked it out, and sure enough, because I had no training again in this area, she was right. My only option was to basically release him back to the street and hope that he wouldn't get hurt or hurt someone else. I'll tell you, we don't become judges to be part of that kind of problem. I left the bench that day pretty upset. I started making calls, and I learned 3 very valuable lessons. The first one is that in Miami-Dade County, we had a mental health crisis. As it turned out, we have the largest percentage of people with mental illnesses of any urban area in the United States. 9.1% of our general population, that's almost 250,000 people in my community, have a serious mental illness. And because the state only provides treatment to about 1% of my population in Miami-Dade County, the Dade County Jail had become the largest psychiatric facility in the state of Florida, housing almost 1,200 people every single day on psychotropic medication at a cost of almost $160,000 every single day, $60 million a year. And because we had done such a bad job training our law enforcement, we had 20 people with mental illnesses die during an encounter with law enforcement because they weren't properly trained. That was the first lesson. The second lesson I learned is this was not just a local problem, but a national one as well. Former Surgeon General David Satcher calls mental illness a silent epidemic of our time. If you're in the criminal justice system, there's clearly nothing silent about it. And the third lesson was that Florida's community mental health system, like most state mental health systems, was created at a time when most people with most acute mental illnesses were still in hospitals, and the community systems were never developed or designed to handle people with such high acuity of mental illness. So now that I learned all that, how do you fix it? And where are you going to find the money to get it done? Well, I like to call the Miami story, our field of dreams. Build it and it will come. Or in the alternative, never complain, you'll be asked to fix it. And they did. And we started about 10 years ago with absolutely no money, absolutely no resources, absolutely no idea to even where to start to look for resources. And I guess in my case, ignorance was bliss. I guess maybe if I knew how challenging it was going to be, I might not have done it. But I have to tell you, with perseverance, with passion, with tremendous publicity, and a lot of luck, we have been able to cobble together not hundreds of thousands of dollars, but millions and millions and millions of dollars to begin to build what I hope will be one day a true continuum quality of care system, so that the criminal justice system does not have to be the front door for people with serious mental illnesses. I just want to remind you that I'm going to talk a lot about a lot of money. And I don't want you to leave here saying, oh, that's Miami-Dade, they were able to do it. We'll never be able to do it. Miami-Dade is just as broke as everybody else. We have a $600 million deficit in my own community. It's tough, but the reality is they're spending the money anyway. They're just poorly spending it. And so, if you can work with your community and learn how to deal and do collaborations and get research and start to educate your policymakers, you will be amazed what you will be able to do. Now, fortunately for us, the Gain Center, which some of you may not be familiar with, Hank Stedman is the director-president of the Gain Center. They were one of the first to get into this field, and they've done tremendous work. And fortunately for us, the director likes good weather and decided to have his first conference in Miami, which of course I went to. And this conference was pretty much relatively close to after I had had this case involving the psychiatrist. And I was becoming very frustrated as a judge because I saw this problem, but nobody really had a clue what to do about it. People in my own community weren't talking about it. So I went to this conference, and I have to tell you, it was almost like a religious experience. I mean, to finally hear people talk about an issue that you were starting to see, but no one else seemed to see, was incredibly liberating and just a tremendous opportunity. So my mission basically at this conference was to track down Hank Stedman and see if I could convince him to help us deal with this situation. Now, I will tell you, I was a man on a mission. I offered to get him into the best clubs in South Beach without waiting. I offered to get him to Joe's Stone Crab without a wait. I offered to give him a tour of our jail and free lunch in my chambers. And to my amazement, he selected the tour of the jail and the lunch in the chambers. And I got to tell you, that was the beginning of a beautiful thing. Because what they were able to do, they gave us their last technical grant of that year and brought in 3 experts to come to a meeting in Miami for us to bring all our partners together to start to talk about this issue. Now, for many, many years in our community, there clearly was a recognition that our system was embarrassingly dysfunctional, that it really just didn't work. But nobody was really talking to each other about it because we're kind of in silos. And part of working in a criminal justice system, it is appropriately adversarial. So you're not even supposed to cozy up with the other side, so there's no relationships to even start to talk about this issue. Well, one of the good things about being a judge is when you invite people to the meeting, they come. And I know that probably better than anybody because, as I mentioned, I was an assistant public defender and I was chief of our county court division. And my age tracks deinstitutionalization pretty well. And so when I was in the PD's office, I started to notice this huge increase in the number of clients we had with serious mental illnesses. And so I remember naively sending out this letter to all the non-traditional and traditional stakeholders in mental health, and I invited them to come talk about this issue. And not only did no one come to my meeting, they didn't even have the decency to respond, so I was a little taken back. Well, about a year later, I was appointed to the bench. I'd had this case with the psychiatrist, and I basically sent out the same letter on my new stationery, and it was amazing how early everybody was. But what was so amazing about the meeting is that you realize so quickly that this is not some individual's fault or problem. The judges are busy judging, the police were busy policing, the state attorney busy prosecuting, the defender defending, and the same person with serious mental illnesses was accessing all these different resources again and again and again. And we went through this process called mapping. And what we did is we mapped out how our criminal justice system intersected with our community mental health system. It didn't. The police would arrest someone on a misdemeanor who was sick. We'd spend all this money evaluating them to find them incompetent and then release them back to the street because there wasn't anything we could do. And we looked around the room and we said to each other, my God, who's more sick? These sane policymakers that developed a system that clearly doesn't work, or some poor person who has a true illness? And as a result of our summit, we analyzed the system, we produced goals, and we kept in mind something they did in Seattle. You don't have to do it, but when you hear the lesson, it starts to put everything in perspective. They took a bunch of folks like you, judges and sheriffs and people in all different positions, and they took them to a local park in Seattle. And they took their shoes and purses and wallets away from them. And they said, tomorrow morning at 9 o'clock, you need to be in court to deal with your case. At 10:30, you need to go see your probation officer. At noon, you need to go see your psychiatrist. And at 2 o'clock, you need to go pick up your medication. Good luck. And what you realize so quickly is that we design systems that work for us, not for people who are truly, truly ill. And so we came up with a motto, and the motto was diversion and linkages to comprehensive care makes jail the last resort. We knew we wanted to create both a pre- and post-arrest diversion program. We understood the problem. We had some good ideas on how to fix it. And we didn't have a penny to our name. And I'll tell you, after 2 days of this summit, I was almost too embarrassed to go ask for money. Because what became so clear to us is that we were part of the problem, and before we could start asking people for money, we better fix our part of it. Because why in God's name are we finding people incompetent and sending them back to the street? Just because that's the way it was done doesn't mean it's the right way to do it. So we went around the room, and there were a lot of resources in that room. Pretty much everybody in that room had a piece of what needed to be fixed. And so the first thing we started to do was to go after resources that didn't cost us any new money. For instance, I wanted to start training our police in crisis intervention team policing. I didn't have a budget for that. The court certainly doesn't have resources. So we were able to guilt in our public hospital to offer free training for our police. And once the first person stepped up and offered to do something without an additional cost to us, that they already had dollars and budgets to do, things started to change rapidly. We set up a post-arrest diversion program, and we got the Department of Corrections to agree at no cost, of course, to take people out of the jail to the providers. We got the providers to agree to start to take this population that were only charged with misdemeanors and did not need to be sitting in our jail wasting huge, huge critical tax dollars. And we went around the room and everybody started to stand up. And all of a sudden, things started to fall into place. And we made progress. We started diverting at a slow pace. We started diverting people that probably shouldn't stay in our jail for more than a day. And we made some progress, but it was a small little dent. We were having problems training enough people because the hospital only could do 30 or so officers a month, and we have thousands we needed to train. And I realized that I had a day job and I couldn't do both of these jobs. So we started to figure out, okay, we fixed our share. Let's step up a little bit and see if we can start to get resources. I fortuitously ran into the chief of staff of our mayor at the time. I started to explain to him about the problem. I had enough data at that point to understand the depth of our problem. And let me stop real quick, because what you're going to find is that there is a huge gulf between what policymakers think exists about this problem and what actually exists in the problem. They have no idea in most cases how many people in their jails have a serious mental illnesses, how much they're spending. And when you start to educate them about this problem, you may get some progress. So to our good fortune, the mayor stepped up, gave us money to hire our first staff person. And what she started to do for us was to collect really good data and to figure out how our system should work better and how we could start to collaborate a little bit. And then fortuitously, SAMHSA put out a grant on jail diversion, and we immediately started to apply. And again, it was all about collaborating. We brought in the person from the court system that writes our grants. We brought in the person from our county who writes our grants. And we sat down and we wrote a really, really good application. And what made our application so great was it had sustainability. We convinced our county that if we do this and it works, that they need to fund these positions permanently once the grant runs out. And of course they did it. We got the grant, and we got our first $1 million. And it allowed us to hire 3 tremendous staff people. The first one was to be a project coordinator to start to coordinate all these different activities we're doing. The second was to hire a full-time crisis intervention team police coordinator so that we could start to offer training on a more regular basis and we could start to really help get our officers trained. And the third was to hire what we call a super case manager who could help oversee the case managers in the community who really weren't doing very well with our population. Because frankly, someone getting out of jail with serious mental illness and getting an appointment 4 weeks later doesn't really do anybody a lot of good. And so we needed to start to tighten it up. We needed to get smarter. We needed to start to educate ourselves. And we needed to move in a much, much different direction. So with this new staff, we began to reach out to our new partners. We started to collect data. We hooked up with a local university who started to get a lot of good data for us. We even started to do things that didn't cost money, but really paid off. A lot of the people who come out of the criminal justice system end up having to go to adult living facilities because that's about the only place that's affordable for most people in these situations. But we found that a lot of these adult living facilities were horrific and that we were putting the individual at risk and we were probably putting the community at risk by sending people to some of these facilities. So I sent a letter to all the adult living facilities in Miami-Dade that were licensed to handle people with mental illnesses. And I said, hi, I'm Judge Leifman. If you ever want to get another referral from the court system, you're going to have to agree to an unannounced visit by a team of professionals who are going to come check you out. Well, this is a free model. This is an economic model that cost us nothing. And if they didn't want to participate, it was fine. We just weren't going to send them any business. And I can tell you, they were getting a lot of business from us. And so we went out. We started evaluating every single provider. We brought in the agencies from the state that are supposed to be evaluating and overseeing these facilities. But we have about 1,200 ALFs in Dade County. And the state pays for one person to oversee all of them. So, of course, they never go until there's a crisis. Well, as a judge, I really don't like crises that I might have created. And so we started to do this. It was a free economic model that had an incredible bang for the buck. And we now have a list. We know who the good adult living facilities are, and that's who we continue to send our business to. Because the idea is that the bad ones won't get any more business and will go away because they'll wither at the vine. And the good ones will have enough business that they can actually grow and be able to prosper. And it's worked out very, very well. The next thing we looked at, I'm from a border state. We have huge immigration issues. And a decent percentage of the individuals with mental illnesses end up getting arrested and coming through our system. Well, we started doing some checking, and it turned out that there were actually a couple categories that allowed undocumented immigrants to receive benefits. And so we figured out what those were. We started to train all of our social workers, and it started to make it easier for us to be able to access some federal benefits so that we could keep these individuals out of our criminal justice system. I then went to the state. We have a very close relationship with them. They're one of our main partners, our Department of Children and Families, and said, look, we're starting to see the same people come back again and again. You guys fund what are called FACT teams. You all know them as assertive community treatment teams. It's an intensive case management system for about 100 people a year. After a little bit of prodding, we were able to get them to dedicate one of their FACT teams directly to our population who are coming out of the criminal justice system. We started to get smarter. How do you get people federal benefits? Well, about 50% of the people you'll find with serious mental illness that are in your criminal justice system are homeless at the time of their arrest. They don't have an ID card. They don't have a driver's license. So how do you get benefits? Well, I called the local Social Security office. I asked them to come down and see me. No one wants to see a judge, so they came. And I said, how do we get these people benefits if they don't have an ID? She goes, very easily. We'll come up with a system. We have a local homeless shelter that makes IDs. We'll tell you what we'll accept on this ID. You get an ID, you come in, we'll accept that for benefits. And it's worked out brilliantly. And so what our social workers now do is if someone comes through our system, they take them over to this facility, they get a special ID, and we can start to use that to help access benefits. It was critical that we continued to meet. We basically meet regularly. We have about 160 partners at this point, and everybody does their share. But we were still having some problems growing our crisis intervention team police program. And then we got a major break. I'll never forget, I was sitting in my chambers and the phone rang and my judicial assistant said, Judge, it's somebody calling from the state attorney's office. Okay. Pick up the phone, the lawyer gets on the line, he says, Judge, we'd like you to come down and testify before the grand jury. Yeah, that's what my reaction was. I said, excuse me? Your first thought is, what'd you do wrong? Well, in Florida, our grand juries are actually used not only to do indictments for capital cases, but to also look at community issues that are of great public importance. And our grand jury had decided that they wanted to look at the criminalization of mental illness issues. And so I went down there and we had an amazing all-day session with them. And about a year later, they released a report. It was entitled Mental Illness in the Criminal Justice System, a Recipe for Disaster, a Prescription for Improvement. And what they disclosed is what most of us had known in the criminal justice system for many, many years, is that we had a mental health crisis in our community. And in response to this brilliant grand jury report, our mayor created a task force not to study the issue, but to attempt to implement every single one of the recommendations by the grand jury. And they were grandiose. This wasn't, we're just going to move some people around. We're going to begin to change our system. And the first thing they said is that we want to see every agency in Dade County trained in crisis intervention team policing, because you have to understand, up until this point, we had almost one shooting a month for several straight years involving someone with mental illness in the police. Well, I have never been associated with a more successful endeavor. Today, all 36 of our police agencies are trained in CIT. We have over 3,000 police officers trained in a 40-hour CIT program, making it the largest CIT program in the nation. We even created and developed an 8-hour CIT communication training program for call takers. Because what we found is a lot of times calls might come in as domestic violence or some other type of case that really at the root are a mental health case, and we need to make sure we get the right officer there. We also created an executive CIT program so that we could train the brass at all of our police agencies on how to operate and run a CIT program so it doesn't dissolve and fall apart after a couple years. We were able to convince the city of Miami to offer a raise for their CIT officers. We were able to train all of our corrections officers in a modified CIT program, and we're able to get them a 5% raise for operating on those floors. Because what we found is in our jail, 3 of our 9 floors are mental health floors. And what the grand jury found is that corrections officers would get punished and then would be put on a mental health floor. So if you're a really bad corrections officer, your punishment would be you get to go work on the mental health floor. Well, what a toxic combination that was. We had all kinds of use of force situations, officers getting hurt, people with mental illnesses getting hurt. And so we needed to change the culture. And so we did it with a 5% incentive raise and a requirement that anybody that's going to serve on those floors would have to be trained in this new CIT program. As part of this grand jury report, there was a recommendation that we put together a new facility that would stand alone as a forensic diversion facility so that we could start treating people differently and soft land people back into the community instead of just kicking them to the curb once their case had been resolved. Well, soon after the grand jury report came out, our county was renewing what we call a general obligation bond in the tune of about $2.5 to $3 billion. See, I told you we've been really lucky. So I went to see one of our commissioners on the county commission who was very favorable towards our issue. And she was able to put in front of the voters an issue that, of course, was under public safety that would allow us to get money for this new facility. And fortunately for us, the voters passed overwhelmingly a $22.1 million bond for us to go build or buy a forensic diversion facility. And I'll talk more about that in a minute. The grand jury's report also recommended us getting more psychiatrists in the jail so they could be closer to the American Psychiatric Association standards. We were able to leverage this report. I went to the finance person for the county, and I said, look, the way we do things sometimes don't make a lot of sense. For instance, if you apply for federal benefits, it generally takes 6 to 9 months to get qualified and then to get your first check. And often, that check is retroactive. So let's think about this for a minute. We have someone with a co-occurring disorder, usually cocaine. They leave jail. We set them up and apply. 6 months later, if we can find them, they get a check from the federal government for about $2,400. It's Christmas in Miami. If we found them, the check is usually snorted within a day or two, and absolutely nothing useful came out of it. So it's great to have this great federal program, but if we can't use it, why are we bothering? So I said, we have an idea. I want you to give me some cash. The nice thing about being in court is we have no overhead. I said, I'm going to go to my Social Security person who I've become best friends with now, and we're going to sign an agreement with them. And we're going to sign an agreement with the consumer. And we're going to sign an agreement with you because you're going to help run the money. And what we're going to do is when we identify someone who qualifies for federal benefits, we will pay for the services that they need until their retroactive check comes back. And we will then get reimbursed for the money we put out with this amount. So I said I need $100,000. And I'm not going to come back because I'm going to leverage this money. It'll be years before I run out of it. And sure enough, they did it. We were able to get at least 50% of the money back. And it was a very, very, very successful way to leverage federal money, but more importantly, wrap your arms around a person who's leaving jail who is in such desperate need of treatment the day they leave, not 6 months later. Well, we went to the state. We asked for a similar grant program from them. We got $500,000 from that. We run that through our homeless trust, which I'll tell you about in a minute. And then we started to have some real money for some real services. And I will tell you, CIT works. In the last 5 years, the Miami-Dade Police Department, CIT officers have handled over 14,000 calls. In the first 6 months of 2009, the City of Miami CIT officers handled 2,000 calls, diverted 1,000 people to community mental health facilities, and only made one arrest. We went from one police shooting a month to 1 or 2 in the last 4 years. We reduced our police injuries 100% since we started CIT in cases involving mental illness. We even were able to affect the bond rating of my city. You want to talk about big money and getting some good favor from your community? I was with the mayor of Miami one day, and he said, you know, Judge, I was going to call you because I really wanted to thank you. And I'm like, sure, what's going on? It's always good to get thanked by a mayor. He says, well, you know, we went to New York to get our bond rating improved. You know, if any of you have been down there, you'll see our downtown has just been built beautifully over the last few years. And he goes, I thought it would be real easy. We'd go show them about all this great construction. We have half the cranes in the United States here in Miami right now. And after this 3-hour bells and whistles presentation, they only had one question. They wanted to know how you got your police shootings down. And why is that important to a bond rater? Well, our communities are self-insured. And every time there is a police shooting, they get sued. And the city of Miami was spending hundreds and hundreds of millions of dollars fighting lawsuits and paying out settlements. And because they were able to reduce that liability, they were able to get their bond rating improved, and the taxpayers in the city of Miami saved hundreds of millions of dollars because of our CIT. And boy, does that give you leverage to start asking for some more money. Because we're saving money now, and we're saving lives. But we didn't stop there. One of the wonderful things that my community has is something called a homeless trust. We're the only community in the United States, aside from having the best weather this winter, please come and visit us. It was 80 when I left this morning. No kidding. And sunny. We're the only community in the United States that has a dedicated tax for homelessness. And so when you come and you spend money, not only are you going to have a great time down there, you're going to be helping our population. And we have about a $45 million budget. And so you have to look where the money is. And I realize that we're probably going to have to do a little bit more than asking. So I actually was asked to go on to the Homeless Trust. I became the finance chair of the Homeless Trust, and now I help manage $45 million in homeless dollars. Dade County was able to reduce its homelessness from about 8,000 people 10 years ago to about 800 today. But what we found about 2 years ago is the last 2,000 people that were still primarily on the street were people with serious mental illnesses. And so through the help of our jail diversion program, we were working hand in hand with our homeless trust. We started to restructure programs. We got them to give us $2 million. And we have created a wonderful outreach program specifically geared for people with mental illnesses coming out of the criminal justice system who were homeless at the time of arrest. It has been a phenomenally successful program because they have the know-how on how to deal with people who have homeless-related issues, and we had the know-how on how to deal with people with mental illnesses. And between the two of us, we've done an amazing job. And they come right to the court. They come right to the jail. We don't let people walk out on their own and just tell them they need to find this service. It's provided every single day right in our courtroom where we are able to access the system, and it makes it very, very successful. And we're in the process of doing something even more innovative. What we found is that there still is this sliver of individuals that we having a hard time getting to comply with treatment, having a hard time getting them off the street, having a hard time keeping them out of the criminal justice system. Because, ironically, our tax has actually gone up in the last couple of years. We thought it would go down, but I think because the economy was so bad, people didn't leave our community. They've just spent more money in restaurants and probably bars. We get money from both of those. Our tax went up and we had some extra money. So we're looking at something called a case rate funding utilization program. And we put a bid out recently to all of our providers and said, we will pay you in a different structure to deal with this population, not in all this silo stuff. That's really hard sometimes for our providers. But we came up with, I think we have about $1 million on the table right now. And what we're doing is they will get paid based upon the success. And they could set up their program any way they want. And so we're at the beginning of this process. It looks very, very promising. But it was more money to the table to help us do what we did. Well, the other thing that we became very, very knowledgeable about, and I think there's a session by Dan Abreu after my program, on a program called SOAR, which stands for SSI, SSDI, Outreach, Access, and Recovery. As I mentioned, it generally takes 6 to 9 months to get benefits, and if more than 30% of the people you apply for get qualified, you're usually doing pretty well. Well, the SOAR program trains you how to train people in your community how to expedite the federal benefit program. It has been enormously successful. So successful that we are now able to get 91% of the individuals who we apply benefits for, benefits within 52 days. Not only has that helped my gap funding because I don't need to stretch it out as long, but more importantly, we're enabling people to get their federal benefits relatively quickly, so when they get out of the criminal justice system, you can put together the system of care that you need and pay for it. According to a study that was done in our community, as a result of the SOAR program, we have actually brought in an additional $6.9 million more federal dollars into our community that didn't exist before. That's a lot of money. And it also tremendously helped our state's budget because a lot of these individuals were getting programs off of the state funding. And so by moving people from the state budget to the federal dollar, it freed up a tremendous amount of mental health dollars that our state is so desperate to use or to have. And so we went to the state and said, okay, we have saved you a lot of money. I need some more service dollars. And so what they did is they cobbled about another $250,000 for us that we have access to because we were able to leverage our SOAR money that now gives us dollars to help people that may not have federal benefits or may not have any kind of insurance, and we can make sure that when they leave our system, they're getting the services that they need. We also found that our public hospital was doing a terrible job billing Medicaid for the services they were providing us. So bad that they were losing almost $800,000 every year. We showed them how to correct it. And once they did and saw that they could actually make money off of this population, they hired a full-time staff to work in the court system to help divert people to the hospital. Because sadly what we were finding is that unless you had insurance, you didn't seem to be sick. Amazing how that works. But once they had benefits through us, they got service. And it really has made a huge difference in helping the population that we need to help. Our next big break came out of a crisis that occurred in Florida. The state had decided that they weren't going to fulfill their legal obligation and take people out of the jail who had been deemed incompetent to stand trial and move them to forensic facilities. It created a horrible, horrible situation. People lost their sight by poking their eyes out waiting for transfer. One man became a quadriplegic. It was a horrible situation in our state, and it finally led to a judge holding our Secretary of DCF in criminal contempt of court. Well, our jail had backed up so bad, we had a horrible overcrowding situation. So I invited a local CBS 4 reporter, an investigative reporter, to come do a story on it. She was so taken by what she saw, she did 17 pieces. The first two ran 10 and 12 minutes each on our 6 and 11 o'clock news. Overnight, we changed the perception of people with mental illness in our community. For the first time, they weren't a bunch of scary criminals. They were sympathetic individuals who were just sick. And as a result of that piece, not to mention the 3 Emmys she won, we were able to make a significant change in getting more resources into our community. Our legislators saw this story. They were stunned by it. It looked like something out of Abraham. I mean, it was just a horrible situation. And our legislature, as a result of this story, created something called the Community Mental Health and Substance Abuse Reinvestment Act. It was basically modeled after the Majorca grants. And what it did is it put $4 million, matched 100% by our counties, offering grants to start to set up jail diversion programs in each community. We now have received 2 of those grants, $1 million each over a 3-year period. It has enabled us to hire more staff. It has enabled us to not only expand our misdemeanor jail diversion program, but we now have a felony diversion program, and we've recently started another $1 million project for forensic diversion. The Speaker of the House at the time saw the story as well, and he was able to get our local state hospital, which had been recently abandoned. He leased it to the county for $1 a year for the next 99 years. So instead of us spending the $22 million to go buy a building, we're using our $22 million bond issue to refurb and renovate a building. And hopefully by the end of this year, we will open what we consider to be a national model, which will be a true felony forensic diversion facility. It'll have all the services under one roof. It'll have some jail floors where people will move to non-jail floors so we can build Medicaid. They will have crisis care. We hope to have a clubhouse model that will be run by people with mental illnesses. We hope to have a culinary program in there so we can teach supportive housing. We hope to be able to build a 100 housing unit project adjacent to the facility so that we can make sure that people are truly taken care of who come into our system. Through all these changes and all these improvements, we now have about 16 people on our staff operating this system. We have cobbled together federal, state, local, and private dollars to pay for this. We have seen our recidivism drop in our misdemeanor population from 70% to about 20%. Our felony recidivism rate is being held steady between 4% and 6%, and our forensic diversion program has a 0 recidivism rate. We have improved public safety, we have reduced police injuries, we have returned our police officers faster to patrol, we're saving critical tax dollars, we're saving lives, and most importantly, we're decriminalizing mental illness. And as good and successful as this has been, we still need our state to work with us to improve our community mental health system. But we truly believe once we get this facility open, we continue to work the kinds of dollars that we have done, we will have created a true continuum of care that is a quality system so people can come to jail as a last resort and not the first. You know, we did a study recently, and this is really telling. One of our grants was about to run out, and I have a lot of staff on that grant, and I wanted the county to pick it up. And we were still $600 million in the hole of the county. And I called the budget director, and I went over to see her, and the first thing she said to me is, "Judge, I wouldn't have even agreed to meet with you, but I just got these statistics from the FBI that shows that the Miami-Dade County Jail has the largest drop in arrest in the country, almost 13%. And our analysis shows that the biggest reason is because of the work that you all have done through your CIT and diversion program. And you are saving us a lot of money. And as a result, they gave us the money I needed to get my staff hired on the county budget. So you have to leverage, you have to be smart, you have to keep looking for ways that you're helping your community, and don't be embarrassed to ask. Thank you.